All right, so this one is going to be upper extremity thoracic region. So we're going to start by pointing out the T1 all the way down to T12. And we see T1 has the first rib, and you can see T2 here, which is around the superior angle of the scapula, and T7 about the inferior angle. So here, T1, T2, T3, T4, T5, all the way down to T12. And we can identify T12 from finding the lowest rib and following it back up to find the last thoracic segment. So let's slide the skeleton around. We need to talk about the sternum, the body of the sternum, the jugular notch right up here, and the xiphoid process of the sternum right here. So xiphoid process, body, jugular notch. So we want to take a look at the ribs. We have 12 ribs on each side. We identified one from the back. 2, 3, 4, 5, 6, 7. So the first 7 are identified as true ribs. 8, 9, and 10 are identified as false ribs. And then 11 and 12 come around and they're considered floating here and then here. The reason for the names 1 through 7 is we see the costal cartilage connects directly to the sternum. 8, 9, and 10, they're false because they don't have a true connection to the sternum. They kind of come up and connect to 7, and then they follow all the way to the body of the sternum. And then 11 and 12 are considered floating because obviously they don't attach to anything. So for our ribs, we have the costal angle out here. And let's see, I think that's about it for this section. All right, so now we're going to cover some muscles of the thorax, starting with the rectus abdominis, all the way from the ribs all the way down to the superior pubic crest. We have the external obliques, which run this direction, like you're putting your external hand into your pants, like you have an internal, but like external pocket on your body. Think of that direction, because that's which way you put your hand in your pocket. So external obliques. The opposite directions, the internal obliques. So they help you twist there. So let's kind of take the chest off, and we're going to look at it this way. So this is going to be the rectus abdominis, and we've got to identify number 8 here, which you see that it runs transversely. So that's going to be the transverse abdominis. So rectus abdominis, internal obliques, external obliques, and then transverse abdominis runs transversely. All right, so we can look at the, kind of move this out of the way for a second. We can look at the diaphragm. We know the diaphragm's the muscle, primary muscle of breathing, and you're going to see that here. So that's going to be your diaphragm. While we're looking at this angle, number 32 here in the back, this is going to be your quadratus lumborum. From T12 runs across the spinous process to the ilium, the crest of the ilium. So it's going to go all the way out. This is going to be a hip hiker muscle, which would allow you to hike your hip on either side independently. A lot of people get tightness in this muscle, which majority of the time is a cause for low back pain, but it can also mimic kidney issues, because we can see the kidneys lie right under the QL, they're the quadratus lumborum. So let's grab our thorax back again. So we need to kind of look at some of the rib muscles. So in between each rib, we have 3 different muscles. We have the external, which runs, so that's going to be your external, that direction right there. Same direction as your external pocket on your pants. The internal is going to run the opposite direction. It's going to go up. And the innermost is like your transverse abdominis, is going to run transversely. So external oblique, or external intercostal, internal intercostal, innermost intercostal. And I think that's it. All right, a couple other muscles we need to touch on are your erector spinae muscles. And those are your spinalis, longissimus, and iliocostalis. So your spinalis attaches to your external occipital protuberance, that little knowledge bump in the back of your head, runs down all the spinous processes. Your longissimus attaches to the mastoid process of the occipital bone, runs down all the transverse process of the vertebrae. And I want to show you on the skeleton what I'm talking about. And then the iliocostalis runs from the costals, so the first rib, down all the ribs and attaches on the ilium. So from lateral to medial, it's iliocostalis, longissimus, and then spinalis. So spinous process to spinous process, and it kind of tells you in the word SP, spinous process. And then longissimus is TP to TP, transverse process above to the transverse process below. And then the iliocostalis is from the costals to the ilium, or we could say from the ilium all the way through the costals. All right, so kind of looking at those bony landmarks on this skeleton. Of course, we don't have a cranium on it. This part that sticks out, if we look at it from the side, that's your spinous process. So it runs all the way down each vertebrae. So when you feel your spine, that's what you're feeling in the back, your spinous process. And then on the side of each vertebrae, we have these transverse processes that stick out on both sides. So 2 transverse process, 1 spinous process of each vertebrae. And then we have the costals, which we reviewed those earlier. And then the ilium will be covered at a later date. So those are your erector spinae muscles. So they get their names from the section of the spine. So we know this is considered the capitis, because when you have a cap, you put it on your head. So think of the capitis, and you can look at the words in your book. Cervicis, because this is the cervical region of the body. This is your thoracic region, your thorax. So cervical, thoracic, and then our lumbar is our low back. So lumbar here. And I showed you earlier the quadratus lumborum, the big muscle that attaches here. So depending on what section we're talking about, say we want to talk about the spinalis, muscle and it attaches to the head, that's going to be called the spinalis capitis. If we're talking about the spinalis muscle group in this section, that's the spinalis cervicis, spinalis thoracis. So all one muscle, but each individual section is how it'll get its name. So if we go to the longissimus, this would be the longissimus cervicis, cervical region, longissimus thoracis. We can keep our spinalis muscle out of the way here. And then longissimus capitis is where it attaches to the mastoid process on the occipital bone. And we would name the iliocostalis the same way. Of course, we know we don't have cervical ribs, so a simple way to start learning that is just think of where your ribs end, because that's where the muscle says it attaches, costalis. So this would be the iliocostalis thoracis and iliocostalis lumborum. So draw that out on paper, review it in your book, and go over this a couple times, and it should be pretty clear for you. All right, so a couple more muscles of the transverse spinalis group that I need to cover is the multifida and the rotators. So we'll talk about the rotators first. So we know this is our spinous process, and here's our transverse process. So remember, we have two transverse processes and one spinous process. So the rotator actually attaches to the spinous process above to the transverse process below. So it's actually going to run just like that. So spinous process above to the transverse process below. And they're going to allow you to rotate, twist, turn. So the multifida actually attach pretty well the same place, the spinous process to the transverse process, but the multifida run multiple levels. Think multifida, multiple levels, which is going to be 2 to 3 transverse processes below. So from the spinous process to 2 to 3 transverse processes below. So it's going to run that way. So your rotator runs from the spinous process above to the transverse process below, one level. Multifida runs from the spinous process above to 2 to 3 transverse processes below. A multiple segment multifida. All right, a couple other muscles we need to add to this is one that sits right on top, or it sits deep but above the rectus or rhomboid minor, which is the serratus posterior superior. You can see it runs down and attaches to the scapula. So when it contracts, it's going to rotate the scapula downward. So number 10, serratus posterior superior. And we'll come on down here to number 17. That is the serratus posterior inferior. So 10 is the serratus posterior superior, and 17 is the serratus posterior inferior. So we see that kind of attaches to the inferior angle of the scapula, so when that contracts, it's going to rotate the glenoid fossa upward, which gives it upward rotation of the scapula.